Right. Let's talk about something new and terrifying because frankly the old and terrifying things are getting a little boring. We've all been through a lot lately. We've learned to wash our hands, wear masks, and actively avoid our most annoying relatives for public health reasons. But just when you thought it was safe to go back outside and complain about the weather, a new menace has buzzed onto the scene. Its name is chikungunya. It sounds less like a deadly virus and more like something you'd shout after a successful round of Jenga, but I assure you, it is far, far less fun. This isn't some flash-in-the-pan illness. It's a global public health concern that's decided to take a world tour. This isn't a hypothetical threat, a what-if scenario cooked up to sell you more hand sanitizer. This is happening right now. As we speak, a significant outbreak is unfolding, and it's spreading with the kind of speed and efficiency that would make a multinational corporation jealous. Alright, so where did this whole mess begin? Pinpointing the start of an outbreak is like trying to find the first person who yawned at a board meeting. But in this case, all signs point to southern China, specifically the sprawling, bustling province of Guangdong. This isn't some remote, sparsely populated region. Guangdong is an economic powerhouse, a manufacturing hub teeming with over 126 million people. It's a place where goods and unfortunately viruses can move very, very quickly. The first whispers of trouble started circulating in the late spring of this year, 2025. Initially, they were just scattered reports, easily dismissed as a bad batch of seasonal flu. A few people with high fevers, bad headaches, and unusually sore joints, but then a few cases became a few dozen became a few hundred, and soon the numbers started climbing with an alarming velocity that made public health officials sit up and spill their coffee. The outbreak was officially recognized in June, and by then, it was clear this was no ordinary bug. The hospitals in cities like Guangzhou and Shenzhen began to see a steady stream of patients, all describing the same agonizing symptoms. The common thread wasn't a shared meal or a contaminated water source. The common thread was a mosquito bite. And just like that, the virus got its passport. The first international leap of the outbreak was a short one, just across the strait to Taiwan. And it arrived in the most predictable way possible, inside an unsuspecting traveler. On July 22, 2025, Taiwanese health officials confirmed their first imported case of chikungunya for the year. The patient was a man in his 20s from the northern city of Taoyuan. He hadn't been on some exotic jungle adventure. He had just returned from a business trip. He went to China for work and came back with a fever, a rash, and a whole lot of pain. This single case was a flashing red light for the rest of Asia and indeed, the world. It was concrete proof that the containment measures in Guangdong, whatever they were at that point, were not enough. Taiwan's health authorities, to their credit, jumped on it immediately. The man was identified, isolated, and treated. His contacts were traced and his neighborhood was monitored for any signs of local mosquito transmission. But his case served as a stark, undeniable warning. The incident sent a ripple of anxiety through the region. Other countries immediately heightened their airport health screenings, especially for flights arriving from southern China. So, let's get down to the brass tacks. Let's talk numbers. Because while personal stories are compelling, cold, hard data is what really paints the picture of a crisis. And the picture here is, to put it mildly, not great. As of this week, the official tally of chikungunya cases within China alone has surged past 10,000. But this isn't just China's problem. The outbreak there is merely the largest and most recent chapter in a much bigger global story. Worldwide, the numbers are staggering. In 2025 alone, there have been over 240,000 reported cases of chikungunya across the globe. Think about that. 250,000 people have been knocked off their feet by this virus in just over 7 months. And it gets worse. While chikungunya is not typically as deadly as some other viruses, it is not harmless. This year, there have been 90 reported deaths attributed to the virus across 16 different countries. 90 families grieving, 90 lives cut short, all because of a mosquito bite. This is not a new virus that just popped into existence in Guangdong. Oh no. Chikungunya has been a seasoned world traveler for years, collecting stamps in its passport of pain from continents across the globe. Before it decided to set up a major new hub in China, it had already made its presence felt in a big way elsewhere. The modern era of chikungunya's global tour really kicked off in the mid-2000s. So who is the master criminal behind this global crime wave? It's not some shadowy organization or a villain in a volcano lair. The primary culprits are two specific species of mosquito, Aedes aegypti and Aedes albopictus. You might know the second one by its more gangster-sounding stage name, the Asian tiger mosquito. Here's how the sordid transaction works. A mosquito bites someone who is already infected with chikungunya, sucking up their virus-laden blood. The virus then incubates inside the mosquito for a few days, multiplying and making its way to the mosquito's salivary glands. At this point, the mosquito is essentially a loaded weapon. When it bites its next victim, it injects a little saliva to prevent the blood from clotting, and voila, the virus is transmitted to a new, unsuspecting host. Let's say the worst happens. A mosquito with a bad attitude and a belly full of virus decides you look like a tasty meal. What can you expect? The symptoms of chikungunya typically appear between 3 to 7 days after the bite. It usually starts with a sudden, high fever and severe joint pain. And when we say severe, we mean severe. People have described it as a crushing, debilitating pain, primarily in the hands, wrists, ankles, and feet, that can make even simple movements like walking or opening a jar feel impossible. This is the becoming contorted part of the name, as the pain forces people into a stooped, shuffling posture. The really frustrating part, there is no specific antiviral treatment for chikungunya. There's no magic pill you can take to make the virus go away. Treatment is entirely focused on relieving the symptoms. Doctors will recommend rest, plenty of fluids to prevent dehydration, and over-the-counter pain relievers like ibuprofen or paracetamol to help with the fever and joint pain. Faced with an escalating crisis in Guangdong, the Chinese authorities have responded with the subtlety of a sledgehammer. And honestly, in this situation, that might be exactly what's needed. They have declared an all-out war on the mosquito population, deploying a massive public health response to try and wrestle the outbreak under control. The streets of cities like Guangzhou have been blanketed in disinfectant fog, but they aren't just relying on ground troops. In a move that is both very modern and slightly terrifying, they have deployed drones. These unmanned aerial vehicles can go where trucks can't, hovering over dense urban areas, construction sites, and hard-to-reach pockets of stagnant water, dropping larvicides to kill the mosquitoes before they can even hatch. The government is also using a stick to go with the carrot of public information. They've enacted strict quarantine measures for confirmed and suspected cases to prevent them from being bitten by more mosquitoes and spreading the virus further. And they're not messing around with enforcement. There are reports of hefty fines being levied against individuals and businesses that fail to clear stagnant water from their properties. So after all that doom and gloom, what can you, an individual who would very much prefer not to have their joints feel like they're on fire, actually do? The good news is that protecting yourself from chikungunya is not complicated. It all comes down to one simple golden rule: avoid getting bitten by mosquitoes. The first and most important line of defense is a good insect repellent. Look for one that contains an active ingredient proven to be effective, like DEET, picaridin, or oil of lemon eucalyptus. Your living space is your castle, so make sure to fortify it. If you're in an affected area, try to stay in places that have air conditioning or that have intact screens on the windows and doors. This creates a physical barrier that keeps the mosquitoes outside where they belong. If your room isn't properly screened or if you're sleeping outdoors, a mosquito net is your best friend. Finally, and this is the big one, we all need to stay informed and take this seriously. Pay attention to travel advisories from organizations like the CDC and WHO. If you travel to a region with an outbreak, be vigilant about protecting yourself and monitor your health when you return. And let's support the global and local public health efforts that are on the front lines of this fight. The threat of chikungunya is a powerful reminder that our health is connected to the health of our environment and our global community. So stay alert, take precautions, and for the love of everything, don't get bitten.